And as parents grapple with whether to send their kids back to school, it is important to know how COVID-19 cases will be handled and who will handle them. School nurses say they're needed more now than ever. 10 TV's Angela Reigert is looking at what a school nursing shortage means during a pandemic.
Kind of a crazy story to step into a role like this during a pandemic.
Kelly Wagner is the president of the Ohio Association of School Nurses.
Even in the 14 years I've been practicing as a school nurse, the needs have changed so much.
Now put a pandemic on top of that.
At the end of the day, when you're back in school or whatever, the one person that people are going to go to regarding COVID, illness, wellness is your school nurse, if you have one.
The American Academy of Pediatrics recommends every school have a nurse, but that's far from reality. This data from the National Association of School Nurses shows only 35% of U.S. schools have a part-time school nurse. Nearly 40% employ a full-time school nurse, and about 25% of schools don't have a nurse at all.
Sadly, I'm hearing about some that are actually cutting and furloughing their nurses right now at a time when we should be doubling and ramping up, hiring of school nurses.
While some Ohio districts are calling for a completely virtual fall, others are opting for a hybrid model, sending kids back to the classroom a few days a week. What are you hearing from your members? Are they hesitant to go back to school?
I think there's emotions all over the place, and obviously none of us want to do virtual learning. That's certainly not preferred. All of us would rather be back in school. I know that. But I think, as nurses, we have to look at evidence and the best practice and what's going to work and give that counsel and advice to our administrators.
School nurses will need to have PPE. They'll also need access to an isolation room where a student will have to go if they're showing symptoms.
And with them only being in school 2 or 3 days a week, I'm hoping that we can kind of avoid a lot of that. But, surely there's going to be kids that show up that are not well.
And who will take care of those sick students depends on the district. A 2017 survey by the Ohio Department of Health found if there is no school nurse, a secretary or someone who works in the office will most likely take care of your child.
We train them as best we can, but that's not what they're there to do. And it's certainly, I know a lot of them, they don't like doing that because it's a huge responsibility put on their shoulders.
That responsibility is felt more so now than ever. And if you ask Kelly, we all have a role to play, everyone from school leaders.
If you can't adhere to those guidelines, it's really not safe to open.
To parents.
If they're not 100% well, don't send them. It will benefit them. It will benefit everyone around them.
Reporting in Columbus, Angela Reigert, 10 TV News.
And we reached out to several school districts here in Central Ohio to see just how many school nurses they have on staff for the fall. We heard back from 2 of them. Columbus City Schools tells us 42 of their buildings have at least one full-time nurse, and some have more than that due to medical needs. But if nurses aren't in those buildings, they serve 2 schools. Hilliard City Schools has 11 nurses, 10 clinical assistants, and 2 treatment nurses. They are shared across buildings, meaning there is one school nurse per 650 students.